An estimated 116 million Americans live with chronic pain each year. That is approximately 30% of the population. Many of these individuals have seen 9 or more health professionals and still remain frustrated and in pain. Chronic pain can cause depression, anxiety, insomnia, weight gain, and other disorders. As chemicals are depleted from the brain due to untreated pain, hopelessness may begin to set in. To some, a pain-free life may seem impossible. Here at Injury Specialists, hope starts with diagnosing the reason for chronic pain. This is the first step toward relief. The approach Injury Specialists has toward rehabilitation is truly unique. The team incorporates a thorough knowledge of injury anatomy, injury physiology, structural and functional changes within the body, and these effects on pain. It is important that the patient needs an understanding of how the pain started so it can be controlled and eliminated.
I'd been in excruciating pain, chronic severe pain for the last 10 years. And after seeing doctor after doctor, I was at the end of my life. I had no life. I had no life until I met Dr. Rachel. And once I met Dr. Rachel, in one visit, in 1 hour, she was able to diagnose me with my condition, and she was able to do something that nobody's been able to do in the last 10 years.
This team of physicians, physical therapists, nurses, radiology technicians, and administrative staff not only utilizes this knowledge, but also stresses patient education. Before treatment even begins, it is important for the patient to realize and understand the connection of their pain to abnormal structure and function. The treatment plan is based on the individuality of each patient, on the patient's history, on the physical findings within the examination, and on any diagnostic tests, such as weight-bearing spine films, a leg-length scanogram, or an MRI.
Here at Injury Specialists, we perform an exam that's called a weight-bearing leg scanogram. And occasionally you can find this exam done at different hospitals or other facilities. But here at Injury Specialists, we do it a little bit different than others that makes us unique. At other facilities, this exam is usually done with the patient laying flat on their back. Here at Injury Specialists, we do this upright. Everything is done weight bearing in a position that we all live in. We don't live laying on our backs. So to measure a person's body with them in a position that they usually don't function in isn't accurate.
During a patient's initial consult with Dr. Barry or Rachel Feinberg, all previous testing is reevaluated and weight-bearing spine films are usually obtained. These x-rays help the physician and the teams explain the connection between the spine and the patient's pain.
Our approach is different because we look at how the patient lines up, because a person's not just a knee or not just a hip. So we use a lot of weight-bearing spine films in addition to CT scan or MRI. And this is a great x-ray because it shows how the pelvis is crooked. You can see that this is oblong, this isn't in the middle, and the spine's curved. And you won't pick that up unless you're looking for mechanics.
However, the more difficult aspects of the patient's pain to explain is the peripheral dysfunctions in soft tissue and biomechanics. It is important for the patient to understand both of these contributing factors.
Our practice goes beyond the normal set of x-rays that are obtained at different hospitals or facilities. Here at Injury Specialists, we use different techniques and positions to test the body's stability in certain positions to accurately diagnose the source of your pain.
During the consult, the physicians will learn details of the patient's physical involvement in sporting activities or manual labor and/or of any trauma or motor vehicle accidents. This subjective information is crucial in determining the treatment plan, as well as gaining the trust of the patient.
I have seen patients being treated for pain in many different ways, but I've never seen the diagnosis of a person using body mechanics incorrectly. And when body mechanics are used incorrectly, that is what causes the pain to begin with. Here at Injury Specialists, what I have seen and what I've practiced is very unique for our time.
After the consult, the implementation of injections, physical therapy, and oral medications are discussed. These are tools used to make corrections, not procedures for temporary solutions. Injections can eliminate pain-causing signals from the spine and nervous system and can facilitate treatment during physical therapy by allowing movement and structural correction with decreased pain. The injections help correct spinal alignment, decrease inflammation, or provide relaxation of dysfunctional muscles.
I had never heard of trigger point injections before seeing Dr. Rachel, so I was really nervous, but it turned out great and it helped my recovery.
With the injections, I was able to comply with the requirements for physical therapy.
Manual physical therapy helps maintain the body with these corrections by focusing on the mobilization of the spine and joints. The physical therapists are trained to evaluate both the structural and functional components contributing to the patient's pain. The therapists collect information on the patient's postural habits at work and home, as well as any recreational activities to start retraining as soon as possible.
I've always considered rehabilitation, the first step is manual, where the therapist actually uses their hands and changes the anatomy, whether you're doing soft tissue releases with your hand or contract relax or muscle energy techniques. A heat pack is very soothing, but the patient can get a heat pack at home. And so if you bring a patient in and you give them a heat pack, you're really not encouraging them to understand their biomechanics or how they move or how they function.
The injections and the therapy are scheduled consecutively to supplement the benefits of one another. Injections allow the therapist to make biomechanical correction that cannot be made with therapy alone. Another component with patient care is the management of oral medications. The goal of providing these medications is to enhance comfort, develop the ability to cope with stress, improve the ability to work, perform daily activities, and make coming for treatment possible. The medications prescribed are not necessarily narcotics, but may include antidepressants, NSAIDs, muscle relaxants, and topical medications.
We have a staff of nurses that are dedicated just to medication management for those that have severe pain because they've had crush injuries or they've had a bad outcome from surgery. And it's helpful to have that one person available to them all the time, and that way we can meet all the requirements for the federal and state guidelines.
For every case, the physical therapist, the physicians, and the injury specialist team work together with the patient. The value placed on education removes patients from the role of victim and instead makes them active participants in their own care. It is clearly understood that without the patient on the team, relief may be limited. It is this collaborative effort at injury specialists that creates the most successful rehabilitation.
Her philosophy on treatment made a whole lot of sense to me. I'm an engineer, so I like to be logical, and her treatment seemed logical, and that's why I chose to come see her first.
She took one look, and honestly, I've never had anyone understand the way that she does. It's amazing.
Dr. Rachel came into the room and she said, "I know what's wrong with you, and we can fix it."
But now I can walk with my kids, I can play with my kids, I can get out in the yard and play soccer or throw the ball. I can squat down and look my son in the eyes and tell him I love him now, where I couldn't do that before.